Good afternoon, everyone, and thank you, Jeanette, for being here today. Obviously, it's a busy time for us all, but I think particularly for you, and so I really thank you for taking your time out of your busy schedule to talk to our AMAQ members today. Welcome to everyone who's viewing live today, and for those who'll be watching later on. My name is Dr Hashim Abdeen. I am the chair of the AMA Federal Council of Doctors in Training, and I'm a rheumatology and general medicine advanced trainee at the Gold Coast University Hospital. So I'd like to begin this AMAQ in conversations by acknowledging the Yagara and Turrbal people on which lands I'm hosting this webinar. I acknowledge the traditional custodians of the various lands across Queensland and Australia and pay my respects to elders past and present. I would also like to extend that respect to any Aboriginal and Torres Strait Islander people watching this session either live today or later on. So let me begin by kicking off this conversation, Jeanette. It's been a crazy year, but in particular a crazy week. And I think, we've had the mammoth task of rolling out the vaccine, which has been under your command. And I think it's been some ups and downs already in that process. But I guess let me start by, when you look back, we're almost a year just over when we had our first case on the 28th of January here in Queensland. And did you think that we would be here in February 2021 rolling out the vaccine? And, there's been a lot of uncertainty for the year. Do you think that we've been, looking back, did you think we'd be here? And what are your thoughts on that moving out?
I desperately hoped we'd be here, but I didn't think we would, which is probably that I didn't have enough confidence in the fantastic scientists we've got around the world. This is just brilliant to have created such a successful vaccine in less than a year, and now to be rolling out is brilliant. And not just one, but a whole multitude of them. So we've got two very, very successful vaccines. I personally don't know which one is the better. One day I think one of them is, the next day I think the other. And yesterday some information came out that suggested that the AstraZeneca one's better. So I really and truly don't know, which is just a wonderful position to be in. So my advice to everyone out there is just go and get the first vaccine you're offered. We just need to get everyone vaccinated so that we can then move on and start returning to more normal lives. This is not sustainable, what everyone's done the last year, but it's brilliant what people have achieved the last year.
And I think that's the message, obviously, we've been giving to our patients as well, that it doesn't matter which vaccine, is that as long as you get vaccinated, that's the major plan.
Yeah.
Of course, this is a unique year for everybody, and obviously in your career as a Chief Health Officer, it's a very interesting year that you've had. I guess, what have been some of your highlights for the year? What have been some of the lowlights, and what do you think we can do all together as a health system?
The highlights just been how everyone's worked together. It's just been unbelievable how people have gone and taken on all of the problems, sorted them out so beautifully and worked through them. And as a result, we've seen here in Queensland and indeed most of Australia that we've had very, very little community transmission. And thank goodness, because we don't understand this virus yet. We still don't. We know that around 10% of people get long COVID. We know up to 50% of people will still have some symptoms at 6 months. So it's a really serious disease. It's not a flu, which of course all of the people watching will understand and know. So I'm so glad that people have been prepared to go on the journey and to manage it and not just say, oh, for most people it's a minor disease and we don't need to worry. I'm just so glad people have gone, well, we don't really know, so let's manage it and stop its transmission so that we've done the impossible, which is we're rolling out a vaccine before the virus has got into our communities.
Yes.
And that's just astounding. That's the perfect health outcome for us all.
I completely agree. And I congratulate you and your team, of course, because Queensland, Australia has done really, very well compared to the rest of the world, but Queensland in particular has done very well in Australia as well. And I guess, now that we have the vaccine, what do you think comes next? What's the future of COVID in Australia, in Queensland, and what can we expect as health practitioners, but also as community members?
Well, I think we get the vaccine out as fast as we can, and I'm very, very confident we'll be able to do that. Last year we rolled out 1.6 million doses of flu vaccine, mainly through GPs in around 2 months. So that's just normal process. So we don't need to up it a lot to be able to roll out 2 doses for every adult over 6 months, which is what we're aiming for. So I'm very comfortable that we'll be able to do this. Now, we need to get those 2 doses out there as quickly as we can across every single part of our state. Then we'll probably have to turn around and, a bit like the Sydney Harbour Bridge, start again and roll out another dose, because we're seeing these new variants.
Correct.
Now, we know this, the vaccines that we've currently got are pretty effective against most of the variants, but I'm not quite sure about this new variant that's spreading in California. So we'll just have to work that through. But creating new vaccines for variant changes is pretty straightforward, standard business. Drug companies do that all the time. So I've not got any concern, and I think we'll be able to do that. So we'll be able to manage that. So there will, I'm sure, need to be another rollout of vaccine. It won't stop what we're doing in terms of removing restrictions and getting on with our lives, but it will then bring in another vaccine for the changes in the virus, and we'll just have to get on top of the virus. Now, the whole world will need to do that.
Yes.
Otherwise, we'll continue to see variants, but we'll manage that. I'm not worried. We've got really good vaccines. They'll be easy to modify and change and roll out. And then the next dose will most likely be, as the case is with flu, that you only need the first 2 doses for the first time, and after that it'll just be a single dose. So I think we'll just start seeing that. These vaccines are much, much better than flu vaccines. I'm a bit scared to say that because then people mightn't be as confident in flu vaccines, but these are really good vaccines, very, very effective, and I think they'll last there for longer. So the flu vaccine is really only at peak efficacy for about 3 months after it's given us, of course, whereas we'll think this one will be much longer than that.
Yes. And I guess in the vaccine, and us being here today face-to-face, which is now a very unique situation, being able to see each other.
It's not unique.
But we're trying to...
We've all got to do it.
We've got to do it. And I think this is where the vaccine is leading us, to be able to get back to normal life. And I think that's what many Queenslanders and health practitioners want to see. I guess talking about normal life, now that we have the vaccine, and international borders is a hot topic as well, and vaccine passports we're hearing about. I guess, what do you think the barriers will be to opening up the borders internationally?
I think first, all Australians who can be should be vaccinated. We've still got to work through what we do with children. So we know children don't get sick, which is fantastic, but if they get it, they'll spread it. So we might have to then, after we've done all the adults who are most at risk of getting serious disease, to think about children. So independent of that, though, we'll need to have all adults vaccinated. And then we'll have to look at what's going on overseas, because we probably won't want to bring in people from countries that haven't had the vaccine roll out. But I would think once, the rest of the world has vaccinated, and we'll do it country by country. We won't wait till the whole world's vaccinated. We'll look at different countries, and then we'll be able to open the borders to those countries, which will be excellent. So I can see that Alan Joyce has got his finger on the pulse, really. Yes. Knows what's going on. And he's suggesting towards the end of the year that they'll start international flights, and I think that's very wise.
Yeah. And I mean, that's something for us to all look forward to, I think, as well, with family members and, people overseas and things like that coming back home as well. Obviously, this is a mammoth task now, where we talk about, vaccinating the entire of Queensland. It is easier said than done, I think, but obviously we're doing such a great job already with this week. We're seeing record numbers in vaccinations going forward. I guess there's now, obviously, and we've talked about this before, the webinar about federal remit and Queensland Health remit, and obviously there's the public and private sectors. I guess there have been talks about mass vaccination centres and things like that that the federal government will be looking at. I guess, what do you think Queensland Health's role will be in that? And secondly, the other question that has come through from, I guess more specifically for this audience, is about vaccinating doctors in private practices, including GPs who aren't in the public system. Who will be doing that?
Right. Well, my view is that GPs should be out there vaccinating. That's what they do all day, every day. They're very, very good at it. And also they know their patients. And I think it's far better that someone who's got any chronic disease at all goes to their own GP and talks to their own GP and gets vaccinated there. That's really important. So once we've got the AstraZeneca vaccine, which is just a traditional vaccine in terms of how it's been made, how it gets stored, etc., although it is in multi-dose vials, but other than that, it doesn't need diluting. It's easier to deal with. I think then we need to get that out to GPs, all GPs who want to be involved, and work with them to go and vaccinate their own people. And as I said before, GPs do enormous numbers of vaccinations every year for the flu. So I think it would be really good if GPs could do it. Then we're also working with pharmacies, because AstraZeneca looks like it's possibly even got fewer adverse events and side effects than flu does. And we've had pharmacies now do flu vaccines for a number of years, and they've got that experience. So it'd be good to get it out there for those people who don't have GPs because they don't have any illnesses and they're fit and well and they don't have a relationship with someone. It would be good that they go there. And I would hope with those groups, plus the Aboriginal medical controlled health centres, so those three groups, that they vaccinate people rather than having mass vaccination clinics.
That's
right. I'm just not sure. There's going to be some of them. So the Commonwealth will have their clinics that will take over from their testing clinics, or they might be additional to those. So those will be in place. And then we're doing our hubs, but that's mainly designed for those high-risk border workers, quarantine hotel workers and healthcare workers who are looking after active cases. It's not really designed for a mass vaccination process. So we'll just work it through and see how we go once we get more supplies, because there's no point planning any mass vaccination clinics till we've got a lot more supply. At the moment, it's very, very, very limited. It's only Pfizer. But fingers crossed, we'll shortly be getting AstraZeneca, and hopefully that'll be able to go out across the state. So I hope, in fact, I'm sure that all GPs are thinking about how they can manage a multi-dose vial with 10 doses in it, so that they can have 10 people within a time frame and be able to give their own patients that vaccine. Because I think most people from who I've been talking to want to go to their own GP. That's who they trust. That's who they know, and that's really where they should be going. I think that's critical. Because the important thing here is not actually the vaccine itself and delivering it, it's the confidence in the vaccine. We're still seeing about 20% of people are a little bit hesitant, and I think it's your own healthcare provider that's critical.
I agree. And I know you've always been a proponent of having your own GP, and every Queenslander should have their own GP, including every doctor should have their own GP. And I think, that trust that you have in a GP and the ability, the flu vaccine and the ability to know how to do vaccinations on this scale is really in the GP sphere. I agree with you.
I agree.
So I guess, the next thing that has been a topical issue for healthcare workers has always been the priorities and where you fit in a priority level, your priority A and 1A or 1B, and what things are going on in that area. And I mean, specifically from the doctors in training who are listening today, there have been some questions about, if you're rotating into high-risk areas such as ICU and ED as a doctor in training, will you be vaccinated the priority 1A or is it priority 1B? And I think the message we talked about before is it doesn't really matter what priority you're in, everyone should just get vaccinated. Everyone will get vaccinated in the right time. But I don't know what your thoughts are about those messaging.
If you're working in any of the hotel quarantine sites, any of those hotels, anywhere at our international borders where we've got flights coming in from overseas, or in EDs or ICUs or COVID wards where you've got active cases, then you'll be in 1A. If you're not in one of those areas, you'll be in 1B. And that's all of the students going through placements, it's junior doctors, it's senior doctors, it's all of our GPs, it's everyone. So all doctors will get done. If they haven't been done in 1A, they'll be in 1B. So 1A should take us, assuming we get all of the vaccine we need, somewhere between 4 and 6 weeks. And then we'll be moving on to 1B. Now, if we get AstraZeneca earlier, then we might be able to get that out across the state and start 1B before we've
concurrently
finished 1A.
Yeah.
So I would think that all GPs, doctors, medical students, everyone should be done over the next few months.
Yes. Okay, that's great to hear, because I think there's always, confusion about what category you fit into and things like that. But I think what you're talking about is really that everyone will be done in a timely manner. I think that's good. The other doctor in training question that came about was around the impacts of COVID on training, of course, and career progression. And obviously there's been many exams affected by COVID in terms of, the lockdowns and things that have occurred, which has really pushed back, I guess, trainees a lot. And really for the colleges, it's kind of brought up the whole point about one-off high-stake barrier examinations and the feasibility of doing these type of exams. In the recent Victorian lockdown, we had the RACP and RACS examinations, which were, the government did work with them to kind of get that across, which was good. And the AMA has been calling on different state and territory governments to provide, I guess, exemptions if they are able to be done in a COVID-safe way. And I wondered what, in Queensland, I guess hopefully there won't be any more lockdowns in the future, but with the vaccine. But if it was, we're trying to talk about whether these exams can be exempt as essential to the workforce, given the big disruptions to training.
So we did work with the different colleges about different exams. I remember meeting with Julie Mundy and with others. So hopefully that all then worked. No one came back to me that there had been problems. I think going forward, my real belief will be that we won't be using those really blunt tools of closing borders within Australia, because we'll be able to do what we do with the measles case. We still have measles coming into Australia from overseas, and we immediately go in and vaccinate all around if people haven't been vaccinated, and we contain it. And our aim is always to reduce to less than 10 cases, and we do that. So I think the same thing will happen here, that we'll use vaccine to go and contain it rather than closing borders.
Yes.
I think that's really
the way the future is. Yeah, I think so. And that's more reassuring for us in this health system, and I think the community as well.
Yeah.
I guess the next biggest question on everyone's mind is mental health in the workforce, and it's been a really difficult, I think, time for the community in lockdown, particularly not so much in Queensland, but perhaps in Victoria as well. But for Queenslanders, in terms of medical workforce, we've had a couple of suicides recently, which me and you have spoken about before, and it's been really difficult to see that and the impacts COVID has had on our healthcare workers and our doctors. I guess I know, John O'Reilly and Keith and Neil have been kind of looking into this as well, and obviously these suicides are something that are endemic in our profession, which is unfortunate. What do you think we can be doing better as a profession to support our junior doctors, our doctors in training, but also our senior doctors with mental health?
It's really, really difficult. I think we've got to remember that they are part of our workforce, no different to anyone else, and often they're a bit reluctant, I think, to go and access the same things that are there. So the employee assistance scheme, to go and talk to their directors of clinical training or their directors of medicals and just access that support. It's tragic to see those really often young, sometimes older, sometimes senior consultants even. It is difficult when you see in your own profession that some people are struggling and don't feel there's the ability to go and get help. Now, as you said earlier in our discussion, the most important thing is every single doctor needs a GP. They must have a GP, and I just believe that so fervently. We've got to access the same support services that we advise our patients to access. So we are trying to, as you said, Dr. Riley, as the chief psychiatrist, has got a group that is working through different strategies, different ways of putting in place support mechanisms and systems, but it is difficult. It really is.
It is really. At the AMA, obviously, we've been trying to advocate on doctor wellbeing and just promote the awareness about it, because I think there are people perhaps within the sphere who don't feel comfortable, and and hearing that message from you about having your own GP is really important, and then accessing those services that you talked about. So the EAP programs within the hospitals, but also services such as the Doctors Health Advisory Service and the Queensland Doctors Health Program. I mean, very really big areas that people probably may not know that they have access to help out there. And in medicine, unfortunately, we kind of wear fatigue and burnout as a badge of honour, and we need to stop doing that. So I agree with you. GP is the first step, and then accessing help afterwards. I guess there's been a lot of pressures with COVID, and obviously, unfortunately, the hiccup with the vaccine that occurred most recently, and there's been a lot of, I guess, and this is related to mental health, I guess, what I've been worried about is that poor doctor who's had a lot of pressure on him or her after what's gone on with that mishap with the vaccine. I guess, what are your thoughts around, I guess, this high pressure situation that we have with blaming doctors with certain situations like this? And, is it a system? Is it a whole system problem? Or how do we address these type of things?
It always is. There's so much pressure that clearly that individual felt under so much pressure that they couldn't take the time to do the training.
Yes.
And doctors feel often that they don't need to do that training, that they've done it before, whereas clearly this is a difficult vaccine to utilise, and you've got to do that training. So that was unfortunate that the doctor wasn't given the support to be able to go and do the training. That training was just so essential. So there's now been systems, of course, that the Commonwealth's put in place to ensure that people do access training that's being provided, and that there's a process to confirm that. And that's really, really important. So in the public sector, what we did is we not only supported people to do the training, but then we did a simulation process. So we're really into now, and I think it's fantastic, that you can actually go through a simulation for all sorts of areas of medicine that we've stopped doing as when I was a young doctor.
Yes.
We saw one, did one, taught one.
Yes.
We've stopped doing that. We're not doing the first one frequently on patients where we're able to actually work it through. So those things are important, but it's just the pressure.
Yes.
It's the pressure of time. Whereas I personally here in Queensland, possibly people are aware, I asked our clinics when they stood up on the first day to do 100 vaccinations, and of course Gold Coast.
Yes,
more
very,
than double
very
that.
proud of my Gold Coast hospital.
I know, I'm extraordinarily proud of them. They've done a fantastic job. But I just wanted to remove the pressure and just start saying to people, just slow down, take it calmly, we'll get there.
Correct.
Brilliantly. And of course the Gold Coast University Hospital has done an absolutely first-class job doing it. But I'm just trying to find ways of reducing that pressure and let people work through things and don't feel like they've just got to rush at it. We've got time. We're not in the position that the UK is in.
Yes, it's cool.
They've done a brilliant job, absolutely brilliant, to get the large percentage that they've already got vaccinated. You can see the case numbers just plummeting as a result, which is fantastic. And there was so much pressure on them. I've spoken to the team that's rolling it out, and truly they've been absolutely magnificent. But they had to do that because every vaccination was going to potentially save a life.
That's right.
Whereas we're not in that position, so we can take it slowly and carefully.
Yes, we're very lucky to be in the position that we are in, and I agree with you in terms of ensuring that there's supports and systems around this, which I think is very reassuring to hear that there are this going forward, because, I mean, you're right, the individual doctors, if they're not supported to do the right thing, and in a junior doctor sphere, I see this all the time, get called on the ward call to do some procedure you haven't done before and you're quickly YouTubing it, which is not the ideal situation at all. And I think especially with something so high risk as the COVID vaccine, we want to make sure that there is user trustability from our end as health practitioners, but also the community as well. Just quickly moving on, obviously workforce another big issue, which I know obviously COVID has impacted to some extent, and really we're seeing decreased amounts of IMGs coming through because of the borders and things. In Queensland in particular, we have, workforce needs in particular areas because we have quite a large population regionally. And I guess, what are your thoughts in terms of how we plan around this complex issue? Because it's been an issue for a long time, but I guess it's becoming worse, and we just need to figure out some solutions, really.
Yes, I am very concerned that usually 10% of our intern workforce are full fee paying students who've come from overseas, who now they're flowing through the system from the past, but of course this year and last year we didn't get them. So that means in 4 years' time we won't have that 10%. So we are going to see an impact down the track, which we've got to prepare for. I mean, there's a few things. We've got our medical workforce plan that's rolling out at the moment, and that's been progressing. I just had the chance to go and check where it was all up to this morning, so that's really good. And our regional medical school is going full ahead. It's fantastic how they've continued that through COVID, all that planning, and they'll be taking their first students into that undergraduate course in Central Queensland next year. So that is really exciting, and I think that will help enormously. I think if you recruit your students from your local area, you're far more likely that they will stay in that local area. We've seen that with James Cook University. It's been a really good result, and we've got some fantastic outcomes up there, and I expect we'll get the same, but it's going to be a lengthy process. So that's 7 years before we get the first graduates. But we'll get them then, and I think that will help enormously. And just the additional resources into there, the additional senior medical staff to be involved in teaching that next generation, that will immediately help that location. So we've just got to do more to get people from local areas coming into medicine. So that's one thing we're doing, but there's a whole lot of other things.
Of course, and there's the National Medical Workforce Strategy that's coming through, and so it's very promising, of course, because regional and remote Queenslanders deserve the same care as anyone, really, and so I think it's nice that we're focusing our energy there. All right, so we're running out of time, but I do want to ask one quick question. Obviously, COVID has put on the back burner plans for every government and organisation for the last 12 to 18 months. And now that we're seeing finally the light at the end of the tunnel, I guess, what are the priorities for Queensland Health in the next year and a half or couple of years, and where are we going from here?
There's quite a bit. We've seen it'd be good to explore this reason. We've seen a significant increase in numbers of patients presenting to our hospital, around 10, 11%. So we need to work far, far better with our primary healthcare colleagues, our GPs, to work out why that's happening, why we're seeing more people coming through to our hospital. So it'd be good to work that through, because that is not the best place to treat people. Really and truly, people need to have a GP and be seeing their GP. So there's that work. And then I think we're going to really have to do a solid piece of work over the next 12 months about what winter will look like next year, because I'm a little bit concerned that we won't have had a flu season for 2 years, because I doubt we'll get flu this winter because we won't have the people coming in from overseas to bring it in. So there'll be a little bit, but I imagine it'll be much like last year, but we still have to vaccinate everyone. We can't not vaccinate. Then that will be the first winter that we'll see any COVID-19 cases, because again, we'll probably be opening up the border. Everyone will be vaccinated, but we'll still see, despite that, some cases. So I think we need to work through what that winter will look like and how we'll manage that. So that'll be very, very important. So we've got to start thinking. Then the really, really big thing we've got to do is mental health. So before COVID, there were a lot of issues in our society with increasing rates of impaired mental health, and we've got to work that through. And again, that's where GPs are just so critical. And I'm sure that as GPs move back to more face-to-face management of their patients, because I know a lot have been using more remote ways of doing it because of COVID, which was so sensible and innovative and great to see. But as they start moving that, I think we'll be picking up even more mental health issues, and we'll have to work them through with our, in our society and how we deal with them. Because going forward. I think that's possibly the biggest issue affecting us all.
Yes, I agree. I mean, obviously, I've only been, I guess, in the healthcare system for 7 years as a doctor in training, but I agree with you. And we're seeing much more busier presentations with multiple comorbidities and also a lot of mental health as well. And it's good to, I guess, that the government is thinking about, I guess, so Queensland Health and the federal government is looking at investing more in primary healthcare prevention, but also mental health as well. I think we've got a quick question, if I can, from online. So this comes from Dilip DeBellia, who we of course know.
Yes.
So can you please confirm when aged care residents and aged care workers are provided vaccination in 1A that GPs attending that are ACF will also be offered the vaccine, or are these GPs expected to wait till 1B? This has not been communicated widely and there is confusion within RSCFs.
Very, very, very sensible question. I'm not sure how the Commonwealth is managing that. If they're not vaccinated through that process in 1A, then they'll be in 1B shortly after. So I'm just genuinely not sure how the Commonwealth is managing GPs who attend.
Okay, so something for us at the federal MA level.
Part of it will be when they're there, because they only go into those facilities for 1 or 2 days and they've gone.
That's right.
So it'll be, but genuinely, I mean, the reason we're tackling them first is because those patients are so vulnerable.
Correct.
Really, rather than worrying about their carers and so forth, they're not getting vaccinated at that stage. Just the staff who are there.
That's right. I guess permanent staff, that's right. And the last question we have is from Chris Perry, our current president, and it's more of a personal question in terms of coping with the pressures of the job and the health of 5 million Queenslanders, and I guess, the criticism that invariably come through, but obviously all the strengths in terms of virtually no deaths in Queensland around the COVID pandemic. And I guess, how have you coped with it? What do you think about it? And, it's been a crazy year for everyone, but I'm sure especially for you.
Well, I've been really lucky because I've been in the role long enough to get a fantastic team that I've chosen and worked with. And so we work genuinely as a team and support each other. And then also I'm very, very lucky of my husband, who is extremely supportive and knows what I'm going through, given his background as a microbiologist. So that's unbelievable. I mean, I didn't marry him because of a microbiologist, but boy, it's been so fantastic having that resource there. And then one thing, and I'm going to push this one, is right at the start, I sat down and thought, what can I do to get, because I knew right at the start it was going to be awful. And I thought, what can I do to protect myself that I didn't do 10 years ago with the last pandemic, which was just a warm-up act. I decided I'd take my own advice. I'm not a great one at doing exercise. I'm a bit hesitant to announce it, but anyway, I thought, so every morning I get up and do 30 minutes exercise. So, and that has made an enormous difference, whether it's psychological, but I sleep at night, I feel much better, and it's a great way to start the day. So I'd recommend it strongly to everyone.
Okay, I maybe need to take that up then. I've been pretty bad with exams in the last year, but much better more recently, so that's good. But I mean, you've had to make so many tough decisions, and we were talking before about, your grandson in Melbourne and things, and, obviously shutting down shutting the borders. It's not easy, and so you've done a great job, I guess, from our point of view, and from healthcare practitioners. I know there's a lot of people who have been inspired by how you've handled yourself, but also, I guess, looking after Queenslanders over the last year, and it's been obviously a testament to the outcomes we've had with COVID. So really wanted to thank you, Jeannette, and also for your time today as well.
Thank you. Just remember, we've got a great system in this state. Partly it's because we have cyclones, and so we have a disaster response system.
Correct. Yes.
And it's an all-hazard response. So we're using exactly the same response for this pandemic as we use for when we have cyclones or floods or bushfires or ships leaking oil or whatever the issue is, we do the same. So no one has to think what we will do. We just stand up as a state and we manage it really well. Because we do it all the time. So that's always, I always think the best way, don't go and create new systems, just use the ones you normally use. And maybe you've got to beef them up or modify them a little bit, but just use normal ones, which is why I want GPs to roll out this vaccine, because they do it.
And I think
it's going to be
a very sensible approach, I think so. All right. Well, thank you again, Jeanette, and thank you to everyone viewing live today, and also for those watching on later on. We hope you will join our next AMAQ in Conversations with series, and thank you again for tuning in.
Thank you.
Thanks.
Thank you very much.